I am Juma P, Karnley, a lawyer in Liberia who got sick in November of 2015. I decided to seek medication. In the first place I went was GFK in Liberia. I was diagnosed of having TB and simultaneously treated. Later on, I developed cough, constant cough. And that cough persisted for years, and I was treated with antibiotics from hospital to hospital, examined to see whether I suffered from TB, and they found out that I was not suffering from TB. But yet and still, and they gave me antibiotics.
Patient who came from Africa who was suffering from repeated cough with sputum in the blood. He was advised treatment for that, and he was evaluated in multiple hospitals before this, and he was advised treatment for the same thing. However, despite the treatment, his cough and blood continued to get worse over a period of time. He was treated for TB earlier, 3 years back, and he was suffering from this complaints for last 3 months. After the evaluation, he was found to have damage in his lung on the right side, and he was advised surgery for that.
2024, I decided to come to India, and the main purpose was to come to school, but equally so to seek medical attention, where I was diagnosed of having some bacteria on my lungs. And at that time, there was a doctor called Dr. Vijay who was there, who diagnosed my cause, and he advised that I be placed on medical. I was placed on medical for 3 months to see whether the cough would stop. After 3 months, I was taken by it and the cough continued. But meanwhile, it was discovered that even if I took medicine, that would not be cured. And so I was advised to take surgery, but yet continue medication meanwhile, while attending school. And I was again diagnosed for further medical attention. Again, I was advised that I should take treatment and take exercise and come back. So after 3 months, I came back. Unfortunately, I left the hospital and gone to SPARSH. And as a matter of fact, he knew my history, he knew what was wrong with me. I continued and finally came to SPARSH. At SPARSH, I was further diagnosed.
And he was even scared that he might have to get his right lung removed completely. So imagine the scare and the fear he would have faced, first because of the bleeding and then the worry on the surgery. Finally, when he reached us, we evaluated him, and he was suffering from a lot of infection, which we treated him initially, and then we prepared him for surgery.
And then decided that finally they will conduct a surgery based on my past history. July 14, 2025, the surgery was conducted successfully on a major surgery where my upper and my middle lobes were completely damaged and cut off, extracted. As I speak to you, the surgery was successful. I was placed in the ICU 3 days, subsequently in the ward. And now, presently, as I speak to you, I'm in good health. My surgery, I have recovered, and my health is at stake.
Finally, he underwent the surgery successfully, and we were able to remove only the diseased portion of the lung and simultaneously preserving almost 50% of his right lung. He is making a good recovery. He recovered well. He got even discharged within 5 days of time, and now within 2 weeks of time, he is back on his feet. He is doing his regular activities, and he is even fit to go back to his native country.
So it is an experience to you people, Africans, who will be in the same category. So we have specialists at the SPARSH Hospital that can tend to these kind of problems. As I speak to you, I'm in good health. I'm about to resume normal duties. So that's the message, that the SPARSH Hospital is known to be having specialists and doctors that can solve these kind of problems. And this will go also to my country. I'm carrying good news to my country to let them know the kind of status I'm in. So in closing, I want to say thank you to that Vijay and the SPARSH Hospital as your proof. They have done very well in restoring my health as I speak to you. I want to say thank you to all the staff, all the doctors, for having worked so hard along with Dr. Vijay and his staff. Thank you.